What is cancer? Simple. Cancer is a group of cells that multiply at fast rates. These cells rob the body of nutrients, disable organs, all while being undetected by the immune system. These cells continue to spread at alarming speed. Complex. When malignant cells fail to go through apoptosis and contact inhibition, these cells go through the cell cycle at rapid rates, so they are constantly multiplying. This is due to the interphase being shortened and suppressor genes and cyclins failing to stop mitosis. If this continues long enough, metastasis may occur, causing other organs to become infected. It's Wilms tumor. Wilms tumor is a type of kidney cancer. The cancer can stop the kidneys from doing their job of filtering the blood, removing water, salt, and waste products, and they regulate the body's white blood cell count and blood pressure. So if Wilms tumor destroys the kidneys, the blood waste will build up in the blood and cells will not get needed nutrients, so they will deplete. Symptoms and screenings. Symptoms: abdominal swelling and abdominal mass you can feel, abdominal pain, fever, blood and urine. Screenings and tests. At first, your blood pressure will be taken and then a blood or urine sample to check for an elevated amount of toxins. Some screenings include ultrasounds, CA and CAT scans, MRI scans, X-rays, bone scans, and surgery to see if the kidney or tumor is cancerous. Treatments based on stages. Stage 1 and 2, surgery. Stage 3, chemotherapy and surgery. Stage 4 and 5, intense radiation and chemotherapy. Surgery. Partial nephrectomy. The tumor and some kidney tissue are removed. Radical nephrectomy. A kidney and nearby tissues are removed. Radical nephrectomy. If both kidneys are affected, then some tissue in both kidneys are removed. Sometimes both kidneys are removed, the patient receives a transplant. Side effects: internal bleeding, infections, pain, and problems with good digestion. 81 to 83 success rate with a bad histology. 98 to 99% with a good one. Chemotherapy, a combination of drugs administered through a pill or directly into the vein that combine together to specifically kill cancer cells. It may be used to shrink a tumor, making it easy to remove, or just removing the cancer entirely. Chemotherapy will decrease the chance of a kidney needing to be removed. These are the commonly used medicines. Side effects are loss of hair and appetite, vomiting, nausea, and frequent infections. Radiation therapy. High-energy X-rays aimed at cancer cells that have survived chemotherapy and surgery. This is especially used if the cancer looks like or already has spread to other organs or is about to metastasis. Side effects: sunburn, fatigue, diarrhea, and nausea. Clinical trials. Clinical trials take place in a research study on the latest possible cancer treatments. They are not completely proven and may not work. Demographics: age 3 to 4, gender, girl, race, African American. People with this birth defect have a greater chance of developing this cancer, and Wilms tumor is a part of these syndromes. Research. The majority of research is by COG and the Mayo Clinic. There are large amounts of COG research facilities in Pennsylvania. Closest ones are Penn State, Danville, and Philadelphia. One of the new ways of curing Wilms tumor is through stem cell transplant, because it increases the amount of chemotherapy the body can take. Also, the stem cells turn into white blood cells that target and eliminate cancer cells. This is a critical treatment if the cancer cells in someone's body do not respond to surgery, chemotherapy, or radiation therapy. Stem cells from the patient's own body could be taken and then get reinjected to go to bone marrow and repair the immune system and create more red blood cells and T cells. Environmental factors. There is no definitive environmental factors, but anything that can cause an alteration in the WT1 and or WT2 gene, such as smoking or exposure to any carcinogen, should be avoided. Prevention. There is no way to completely prevent this cancer. However, if the child has the signs and symptoms, you can get kidney ultrasounds to detect the cancer at an early stage.